When starting your Medicare-funded home healthcare agency, you'll be required to have an accreditation body. The accreditation body performs regular surveys about every 2 to 3 years to give you the seal of approval that your agency is compliant with state and federal guidelines. Without accreditation, you won't be able to bill Medicare and most, if not all, private insurance plans that are managing Medicare lives. We just completed our survey with CHAP, and I'm ready to talk about how that went. Here on this channel, I've been covering how to start a home healthcare agency. I also talk about my other business ventures and cool projects like the one in Italy where they're selling properties for just $1. The reason for this is because my mission is to give you a clear pathway to living your dreams. My name is Karl Pierre, and this is Ian's Money Life. Before we get started, just a reminder that I'm putting a step-by-step course with a mentoring option to start a healthcare staffing firm. It's much easier than starting a home healthcare agency. So if you're interested, make sure that you email me at karl@soulsweetpierre.com, subject line staffing agency, and I'll get more information out to you. We just completed our survey, so this is still fresh in my mind. I'll be talking you through the process, the follow-up, and how we passed our accreditation survey. The first thing that I have to cover is the preparation for the survey. Remember, I told you it's all in the preparation, and the great thing is that the accreditation bodies and the consultants will put together a pre-survey preparation checklist to get you on the right path. This checklist is going to give you a breakdown of what policies they're going to want to review when they do the survey, and also some checklists for you to review your personnel records as well as your patient records, so that everything is already pre-scrubbed and in shape for when that survey arrives. The reason that you want to make sure that you really prepare for this survey is because first impressions matter. When this person comes into your office and they meet you for the first time and you're well organized and well prepared, they're going to respect you and they're going to approach you completely different as opposed to somebody who's a bumbling idiot and a mess. No matter what you do from that point on, it's going to be hard to reclaim their trust and reclaim their interest or their belief that you are running a good operation. If you are prepared, not only will you present as more professional, but you'll also be more confident in how you project who your company is and who you are, because you know that you have prepared for this survey and you prepared for this interaction. If you're not prepared, it's going to show. You're going to be nervous. You're not going to be able to find documents. So make sure whatever checklist they provide you with, you run through that with your team. Take it seriously. Note what you could have done better. Get all those things organized so that when the survey arrives, you're in good shape. Another thing that you need to remember is that you're going to be running with live patients prior to your survey arriving. So you want to make sure that those records are in really good shape. Now, the rule is that you have to have serviced at least 10 patients and have 7 active patients on service for when the survey arrives. Now, this is a little bit tricky because you're going to be assuming cost to provide services as if these were Medicare credentialed people. Some of them may be on Medicare, and it's probably in your best interest to do that because after you pass survey, you're going to be able to bill those same Medicare clients. So take this part seriously. See these patients. Make sure that you onboard real patients so that your nursing staff and your therapy staff have the proper experience so that that carries through in the future when you're providing services after accreditation. Next is the survey itself, which is broken down into 3 parts. Part 1 is the arrival and the general review. Once you have those 10 patients, you report to the accreditation body that you're ready for survey. The crazy thing is that the surveyor is unannounced. There's no schedule, there's nothing that you can do to kind of predict when they're gonna come. You just have to be running your business like you would any other day. So your staff, once you put in for readiness, nobody should be on vacation. Everybody should be around and working from the office so that when the surveyor does show up, everybody who's involved in that survey comes to the table and starts the process. When the surveyor arrives, he's going to take a look at your office, make sure that you're set up properly according to the standards, take pictures, take notes, that sort of thing. And then he's going to ask for the team that's going to be included in the survey. Typically, it's going to be the administrator and the director of nursing. However, when we did our survey, we had everybody involved that's part of the critical team. So that was the administrator, the director of nursing, the assistant director of nursing, and the alternate administrator. Because you want those alternate roles to know what to do when surveyors come in the event that you get surveyed in the future and you're not in town or something along those lines, right? They need to be able to step up and get it done. If you include them from the very beginning, they're not going to be afraid, they're going to be comfortable, they're going to know what that process is like, and everything's going to go smoothly. When I compare this survey experience to the surveys that I have in New York, very different. When the CHAP survey came in, it was one person. When New York comes in, it's 3 to 5, much more intimidating. The representative from CHAP also said that CHAP's approach is really to be your partner. They're there to help you stay compliant, help you meet federal guidelines, and they want you to stay in business and stay open, right? So they're not really there to crucify you, they're there to enhance you and make your operation a little bit better. Once the survey is settled, he's going to ask for all of the relevant policies. And this is where I have to give my partner a shout out. He was extremely prepared. He had all of our binders put together, and he also had one kind of like summary binder, a pull-out binder, that had all of the key policies that they've already notated on their survey readiness guideline book, that we had it all in one place, right? That way, it made it a lot easier for the surveyor to comb through all the points that he's going to be looking for, rather than going through all of these policies. There's like 15 plus binders. To have him kind of go through and mark off each one seems ridiculous. But we brought all those binders together, and we brought like the Cliff Notes version of our policy and procedures, so it's easier for him to comb through and understand. And this is what I mean about being prepared for your survey. That already puts you in good favor, because it's making that survey's life that much simpler. It shows that you're professional, it shows that you're thinking ahead, and that you're the right team. Remember, on day one of the survey, it's more of a review of your policies, a review of your office, the administrative processes, and it goes fairly smoothly. Towards the end of that day, they're going to request personnel and patient records. And the patient records is really what allows them to prepare for the next day, which is your site visits. Part 2 is the patient care review, including home visits. Day 2 is really cool because that's where you get to see how your team actually functions in the home of these patients. If you're the founder of a home care agency and you're not necessarily a healthcare professional, this is the opportunity for you to see how well your staff is doing. Now, for those of you who are more entrepreneurs, your staff are going to get dinged for something. Don't crucify them for that. Really use it as one of your own learning experiences so you know exactly what surveys you're expecting from a patient care standpoint. On day number 2, the survey is going to look at 3 files and say, hey, I want to see these 3 patients. And it's going to be your team's responsibility to arrange the schedule so that 3 different caregivers are going to be providing skilled services for that client. It's most likely going to be 2 nursing services and 1 therapy service. So 3 different providers are going to have to be there. It gives them a bit of range to see who is good at what they do, who may not be so good, who may need some improvement. Remember, this is all about internal improvement and meeting the minimum standards, okay? So they're gonna pull 3 files. You're gonna have to schedule those 3 appointments for that day and make sure that the patients are home and that your 3 caregivers can show up and do their thing. This might be pretty nerve-wracking for some people because everything that you've been working on in your entire professional life is going to be questioned, all right? This is a nurse who's doing your survey, so it's going to be somewhat subjective because they're going to be looking at it from how would I approach a visit, and is this nurse approaching the visit in the same way? Are they professional? Are they clean? Are they following proper bag technique? Those sort of things. The therapist at the same time is going to have to also adjust to this third person kind of supervising their visit. It may also be nerve-wracking for your patient. Why are all these people in my house? Who is this guy auditing you? Does this mean that your agency is somehow bad or delinquent? So you have to kind of manage all of these things. Remember, the surveyor is there to review whether or not you're admitting the patients properly. Did you give the patients their Bill of Rights? Did you get all of the necessary sign-offs? Did you leave a schedule inside that patient's home so that patient knows exactly what their plan of care is and the frequency of their visits? What is the bag technique that your caregivers are providing? Are they clean? Especially in this time where COVID is on everybody's mind, infection control is super important. So you want to make sure that everybody's practicing proper bag technique. This is where I guess a lot of people could get dings really quickly. Make sure that there is a plan of care in the patient's home. Make sure that there's a calendar in the patient's home. Make sure everybody's following their bag technique, and make sure that your patients know what to expect and that you're going to be getting surveyed at some point, so that when you do call them to say, hey, we're going to be getting surveyed, somebody else is going to be there, it's not the first time that they're hearing that, all right? Remember, success in your survey is all about the preparation. Part 3 is the exit interview, where you get briefed on your deficiencies and what you need to correct. So for the exit interview, the surveyor is going to sit everybody back down in the conference room or your meeting area, and they're going to let you know exactly how you did. They're going to let you know what you did well, and they're also going to let you know what needs improvement. These areas of improvement are going to be called deficiencies, right? These are more or less the points where you failed, all right? There's not going to be a Medicare survey that is deficiency-free. Even if it was deficiency-free, it usually raises a red flag for a secondary audit, because they're trying to understand how in the world did an agency actually make it through a survey free of deficiencies. It just doesn't happen. If you ask hospital administrators, nursing home administrators, other home care agency operators, they're going to say deficiency-free survey. When it comes to a Medicare survey, not happening, all right? Be prepared. Obviously, the fewer the better, but you're going to get dinged on something. So in our exit interview, we sit down with the surveyor, he goes over these deficiencies, and they're going to be a combination of policy deficiencies, maybe some personnel deficiencies, as well as your patient care deficiencies. In total, we had 6 deficiencies, which I hear is pretty good or fair. And what they're doing in these deficiencies is giving you an opportunity to, one, explain what went wrong. It may be a difference in how each team is interpreting the policies. One of the things that we got marked, we actually got removed because we were able to point out in our policies why we're doing something a certain way. And the way that we were charting was consistent with our policies, and our policies were consistent with state guidelines. So one of those deficiencies got removed. They want you to be able to go through that process, because sometimes you're going to have rogue surveyors that are really there to hang you, and you need to know how to defend the practices of your agency, especially when those practices are compliant. Another thing is they want you to be able to go through a proper plan of correction, all right? Throughout the life of your practice, you're constantly going to be tweaking and improving your policies and your procedures within your company. And these are usually self-directed. Remember, you're getting surveyed every 2 to 3 years. So they want to make sure that you guys are self-monitoring and self-policing and know what that process is like, right? So they make you actually go through that process. You find out what's wrong with your company, you come up with a plan of correction, you come up with an implementation plan, and then you come up with a review plan. How are you going to check on the deficiency in the future to make sure that the changes that you implemented are actually catching the problem? This may be just a retraining of personnel. This may be changing your software so that there's hard stops at certain places. This just may be your auditing process that needs to change so that you're auditing more frequently to catch these sort of mistakes. You may have a personnel problem where no matter how much you train and educate this person, they're the problem, and the solution to that is changing out that employee or maybe changing out their responsibilities, okay? So this is what the exit interview is all about. It's really to educate you, show you what you did wrong, and that you know what you need to correct. After the exit interview, the surveyor is going to put together a formal report that they submit to their review board. The review board is then going to say, do these deficiencies make sense, yes or no? And they're going to rank those deficiencies from, I guess, moderate to in jeopardy. An in jeopardy review really is bad because it pretty much puts your license in jeopardy and your ability to function as an agency in jeopardy, and that is no good. It usually results in a secondary survey to make sure that you got your act together, all right? So you don't want any high level or sentinel level events in your survey, because it's not really a good thing. But either way, this review board takes a look at what the surveyor put together and then puts their final stamp of approval on the survey, They send it back to you with the opportunity for you to now come up with your plan of correction. Once you come up with your plan of correction, you submit that back in, they review it, they accept those plans of correction, and you're done. You're now accredited. And that's the phase that we're in our practice, and that's the phase that I want you guys to be in as well. I hope that you found this video helpful and that it helps you ace your survey. Remember, it's all in the preparation. Also, if you feel like this is too much for you, there's always healthcare staffing. Make sure you reach out to me if you're interested in starting the staffing firm mentoring program so that I can put you on the right path. Once again, thank you for joining me here at ENCP Life. I'll see you in the next one.